to start with respiratory tract. And there are some important aspects that I want you to keep in mind. It will help you to understand, especially when we talk of some of the important microorganisms that cause problem in respiratory tract. Now, if you remember, we've been talking about anatomy and physiology of the respiratory tract. And once you inhale a microorganism, of course, there's a whole tract there, beginning from nose and throat. Then we have upper and lower respiratory tract. Then we have lung and conducting systems. And then finally, we have respiratory membranes, also called gas exchange area. So if you pay attention that many times, depending upon the size of that particular microbe, will determine where the attachment of those microbes can be and where they would finally lodge. Now, if you pay attention to the whole respiratory tract, there is a conduction pathway that goes all the way till respiratory bronchioles. And after respiratory bronchioles, where you have the muscle layer, we have respiratory membrane. So the disposition of those particular microbes depend upon their size. That's the important thing that I want you to understand. If the microorganisms are more than 10 micrometer, they are going to lodge in nose and throat. Upper respiratory tract infection, very common, especially in throat, because that takes the major brunt of whatever we take in. And then any particle from 5 to 10 micrometer will lodge itself into upper and lower respiratory tract. And then again is a conduction pathway. And then finally, a microorganism has to have a size less than 2 micrometer to lodge itself and cause pneumonia, especially for those particles that cause pneumonia. And if you remember, the size of a red blood cell is 5 micrometer. The size of a white blood cell is somewhere from 12 to 15 micrometer. And the size of monocyte macrophage is about like 2 micrometers. So we're looking at a bigger size. Now also remember that especially upper respiratory tract, there is a cilia there. So that's a propulsive movement that's going to push mucus outwards. And those people who are chronic smokers or alcoholics, they kind of lose that power to push out. So they are the one, their ciliary action will be muted. Now, classically, when we talk of gram-negative rods of respiratory system, these are the 3 major bacteria that we usually think of: Hemophilus, Legionella, and Bordetella. So let's take Hemophilus as the first one, as it suggests Hemophilus influenzae, suggesting to you that it's something to do with influenza, but it's nothing to do with flu. So it's nothing to do with flu. Flu is like a layman term that we say. People sometimes refer to common cold as flu. I've got flu, I've got stomach flu. These are layman terms and not the scientific terms. And again, you can see respiratory mucous membrane, and these bacteria are sitting on top of that. Now, if you look at their biology, they tend to be very small. Remember, I told you small because they are gram-negative, and they need to go and lodge themselves into the respiratory area. And they are gram-negative. They can be pleomorphic, suggesting that could be cocci or bacilli. They are facultative anaerobes. They can ferment. The most important thing for their pathogenesis is that they have X and V factor, and we will discuss that in a while. We divide Haemophilus influenza into different types, from A to all the way F. And then again, biochemical, we can also classify them from 1 to 8. The other important thing for many different types of H influenza is, especially H influenza B, is called HIV. It's not HIV, which is human immunodeficiency virus. HIV suggests that's the most virulent. And why is this virulent? Because it carries a polyribitol phosphate in the capsule, which is called PRP. And that basically allows this particular bacteria to cling on to the structures, whether they have a pili, suggesting, of course, because they have a hair-like projects, or they can also attach themselves to non-pilous structures. Now, as I said earlier, Haemophilus B is the most important thing, and that's why there was a time we used to have a lot of problems, especially in pediatric patients, but ever since we got this vaccine available, HIB, so that's a Haemophilus influenzae type B vaccine, which is, again, very important as a part of childhood vaccination. Doesn't mean that there are not many other Haemophilus species. I'm going to talk about at least 3 species in this genus which are important, especially for differential diagnosis. Number 1 is Haemophilus aegyptius. That, again, is a very common cause of acute and purulent conjunctivitis. So that's there. We have pus formation in the eye. Haemophilus ducreyi is basically a differential diagnosis when we will discuss syphilis. I'm going to talk about a ulcer on the genitals. It's called chancre or canker or chancroid, something to look like a chancre. And then again, Haemophilus ducreyi will come. And then finally, Haemophilus influenzae, para-influenzae. So that's like a different isolate, whatever, but it's not pathogenic. And many a time, if a bacteria is non-pathogenic, and if a person has that as an opportunistic infection, that's very common for AIDS patients and people who have immunodeficiencies. Now, if you look at the clinical picture, you can see from here on the left-hand side, H. influenzae, typically meningitis. So that's where it used to hit children, because they used to have meningitis before we have HIV. Otitis, non-typable, sinusitis, epiglottitis. So you can see all these terms ending with itis mean inflammation. So you have all the way upper respiratory tract and lower respiratory tract, all the way till your respiratory membrane where you have pneumonia. And non-typable basically means that, remember I just told you from A to F, sometimes we are unable to type them because of many different reasons that we may not be able to find those antibodies. Haemophilus aegyptius, again conjunctivitis, and it can also cause, we call fever. So that's another type of a fever, a purpuric fever that normally get. And as I just told you, and I'll discuss that again, Haemophilus ducreyi, which is a painful ulcer on the genitals and lymph nodes, is called chancroid, or chancre or canker. These are 2 normally terms that we will discuss when we talk of STIs and STDs. We need to grow that on the media, and because to test for culture sensitivity. So we have to provide them with some growth stimulating hormones. And as I said earlier, X factor and V factor. X stands for hemin. There's still a lot of debate going on as to what that factor is. But we do know that V stands for vitamin, and it is a nicotinamide adenine dinucleotide, NAD. So imagine if this bacteria was to grow in your system, it's going to chew up all of these supplements that you may have in your body. So we basically grow this particular bacteria on a heated blood agar. So those of you who came to the lab or come to the lab, we give you a nutrient agar. It's like a China grass, like a gelatin. But this basically is where you heat the blood, become chocolate, and that's where we have to grow Haemophilus. A typical gram stain you can see on the top. And then again, you can also see a scenario, especially in Africa, where there is no such thing called childhood vaccination, and you can see tons of this particular bacteria growing especially in CSF of those babies and those children, causing overwhelming meningitis. I just told you it has a polysaccharide capsule, and it has got a lot of different antigens over there. And the most important thing that we are interested in basically is a lipopolysaccharide which has endotoxin activity. So again, gram-negative respiratory rods, gram-negative per se are important. And most of the story that you will hear for the problems that we have for this bacteria is before the introduction of HIV vaccine. So you can imagine that it had a very high mortality. So once we have a vaccine introduced, especially in this part of the world, we pretty much have taken care for all the problems. The only problem we do have is now, because vaccine is based upon the capsule, so we may have some problem with non-capsulated or non-typable strain, because if you cannot have a capsule, you won't have any kind of a antigen expressed on the surface, so we may have a problem. So the most important thing is PRB, as I just told you, is there that will give an added advantage to this bacteria to attach. So if you pay attention over here, ribosyl ribitol phosphate, and it has that kind of a hairy-like projections, and it will attach to those respiratory cells, and then of course attachment, invasion, and infection will begin. What are the typical infection caused by Hemophilus influenzae? Again, you will see that you would not see in this part of the world, but you'll see in Asia and Africa where people don't get vaccination. And you will see again on the top meningitis, conjunctivitis, sinusitis, and then again some of the skin infection like cellulitis. And if you know your anatomy of upper respiratory tract, so you will see the mucosa from nasal mucosa, oral mucosa, sinus mucosa, all the way through eustachian tube connects with the middle ear. And middle ear, if you remember, has a very thin roof, and that's the ethmoid, the base of ethmoid sinus. And if pus accumulates and pushes itself, it's going to go either rupture the eardrum or it's going to go up and cause meningitis. So that's what used to happen in this particular patient before the advent of vaccine. How does it cause disease? Again, it colonizes the upper respiratory tract. So the moment after birth, babies will pick it up. And then there's always a danger that they can, if they're not properly vaccinated, they may cause acute disease. And those of you who have seen especially neonatal patients and toddlers, you will appreciate that otitis media is one of the commonest things that you see. And if you remember, I also discussed with you something called myringotomy. Does anybody remember what is myringotomy? No? Remember I said that the rule of surgery is that wherever there is a pus, we have to drain it. And if you leave the pus to itself, it's going to go and burst open and rupture. So if you rupture something, you will have very bad scar, and you have a lot of fibrosis. So we would rather give you a scar, cut it up, so you have a healing by primary intention. So what they normally do is, if especially babies get repeated otitis media, ear infection, so we put a small tube in their eardrum, so the drainage can take place. So there's no such thing as a rupture causing ugly scarring there. So that's what is called myringotomy. And again, as I said earlier, disseminated disease can only occur if the children are unvaccinated. So that's a major thing that many of the states have made sure that they mandate by law that the children have to be vaccinated. Okay, then again, as far as pathogenesis is concerned, I'm pretty sure by now you must have realized that when we talk of pathogenesis, the very first thing we need to talk of is attachment of bacteria to those particular cells. So there's a property called tropism. So cells have this affinity, a liking to be attached to particular cell because of XYZ reasons. In this case, this is these polysaccharide that is a hair-like projection. It clings on to the cilia expressed on the respiratory membrane. And then again, if there is no antibodies, remember for any encapsulated bacteria, you have to have opsonins, like antibodies. If you have deficiency, for example, if you have splenectomy, and if you have some other problems in terms of humoral immunity, immunodeficiencies, you may have problem with taking care of this particular bacteria, and then it can spread to meninges, and it can spread as a blood-borne infection, bacteremia, and wherever the blood takes, it will go over there. In an unvaccinated individual, a child, meningitis remains number one clinical presentation. Epiglottitis basically is inflammation of epiglottis. And if you remember your gastrointestinal tract, when the food bolus goes down the lower part of the larynx, pharynx, and then close to pharynx, and then epiglottis basically covers up, pushes up on top of the air pipe so the bolus of food can pass. So in this case, if that's swollen, we'll have problems there. And again, pneumonia, especially if you are old and you are a chronic smoker, you are alcoholic, things of that nature, where your cilia is disturbed. If you look at the epidemiology, you will see that most of the time, as far as H. influenza B is concerned, it's pretty much eliminated because of the vaccine. The only other things that we may see in United States and some of the Western world is STD, where people will get this particular Hemophilus by some of the sexual pattern that they may have, and then they will pick it up from patients' oropharyngeal flora, and then again will present as a genital ulcer. As I just said earlier, when we have problems of complement, if you don't have a complement, or you have just gone splenectomy, you want to make sure that we do give you a passive immunity for protection against this bacteria, especially for the capsulated bacteria. These are the number of reported cases for invasive HIV in person aged 5 years and less. And this is from one of the states. It varies from state to state. I just picked up one. And you can see 1992, it was way high as compared to 2008 and later. But you will see a pattern that keeps on coming. And then again, why is it that it keeps on coming? Also remember that some of the states may not mandate vaccination, and CDC does recommend and make sure that all the children are properly vaccinated. How do we diagnose? Again, microscopy is a sensitive test. We can do culture on chocolate agar. What is chocolate agar? Is heated blood. And then again, we want to do antigen-specific tests, especially if we fear that this is coming from HIV. Broad-spectrum antibiotics usually are given. And then active immunization, again, for PRP vaccine is the most important recommendation that we normally do. And as I said earlier, very rarely it's seen, so you have to travel to Asia or Africa to see the advanced cases. Okay, let me jump to the